on your report, you usually have patient's name, date of birth, medical record number, auth information. Somewhere near the bottom, it'll tell you what kind of exam, for example, chest 2 view, and it'll also give you a reason for exam. Okay, so you'll have this information when you go out to look for your patient. Okay, so, Thaddeus.
Yes.
All right, great. Hello, good morning.
Good morning.
All right, my name's Wilson. I'm from X-Ray. May I get your full name and date of birth, please?
Yes, Thaddeus Craig, May 16, 1973.
All right, great. So, first thing, we do our ADIT, introduce ourselves so they know who we are. Right? You want to know who's asking for your name. And then also make sure you do get both identifiers, full name and date of birth. Okay. Also, remember, always have them tell you, don't tell them and ask them to confirm. Okay. In addition, if the patient is an inpatient, they will usually come with an armband, a wristband. So always double check the wristband, but also make sure the information matches what you have on your paper. I do not recommend checking the wristband first, because what I find happens is, for example, may I see a wristband? Okay, and then if after that I ask, what is your name and date of birth? Patients, for whatever reason, tend to do this. And they read off the wristband, right? And that's not what I'm looking for, right? So have them tell you the information first and then check your wristband, just to avoid that. Okay, great. In that case, if you'll follow me over to the X-ray department, and get over to the room, and now I can go into a bit more detail with my ADIT. So I still need to do D and E, right? Duration, explanation. So great. So today we're going to be doing some X-rays for your chest. Does that sound correct?
Yes.
Okay, so always make sure that the X-ray that you're doing is what the patient is expecting, right? They may have foot pain or abdominal pain, and so they're like, no, I don't need a chest X-ray. What's going on here? Okay, so always make sure that this is what they are expecting. Okay, and then duration. For durations, I don't like to give exact numbers. I always like to give either ranges, or I like to be kind of vague about it. And the reason is just because if you say, oh yeah, this is just going to take 5 minutes, that patient's going to be watching and be like, took 5 minutes and 12 seconds, what's going on here, right? So it's better to give a time range, give yourself a bit of wiggle room just in case something unusual happens and you need longer than expected. Okay, so I may say something like, okay, it's a chest 2 view, but I'll say, all right, so we're going to be taking 2 to 3 pictures. This should take somewhere between 5 to 10 minutes. Even if I know I can do a chest X-ray in 3 minutes, so 5 to 10 minutes, just to give myself that breathing room. And if I do finish it in 3 minutes, then even better. The patient's happy. It's like, wow, finished ahead of time. Okay, so just some kind of like psychological tricks. I don't really like using the word tricks, but it's I mean, in practicality, it's very useful to help with your patients. Okay, let's see. All right, so we've done our duration. We're gonna do our dressing instructions, right? So, okay, everything from the waist off, right? Here's a gown. Put the gown open in the back, okay, so you don't flash me if the gown accidentally opens. And then also, if the patient is female, make sure you check for pregnancy. So you would ask, okay, is there any chance you could be pregnant? Okay. Patient says,
calling me.
oh, okay.
Well, can I ask you this? Is like, what if she don't know?
Okay, so you ask pregnancy, you're like, yes, no, or I don't know. Regardless, well, sorry. So if the answer is yes, you know. Hey, morning. If the answer is,
Do you want me to grab it?
yes, please, 3 sheets for him. If the answer is no, or I don't know, you don't trust that. Always follow up a question of pregnancy with, when was your last menstrual cycle?
Okay.
When was your LMP? Okay, so the patient says they're pregnant, okay, they're pregnant. If the patient says no, or I don't know, do not trust that answer.
Yeah.
Always ask for LMP afterwards. A lot of places are looking for within the last 10 days. Some places look for within the past month. It just depends on your facility, so wherever you go, make sure you check their protocol.
Okay.
Okay. Now, even if the patient is pregnant, or even if the LMP is outside the allowable range, that does not mean you can't do the exam. For something like a chest x-ray, you just need to take extra precautions. You shield them more than you normally would. For something like an abdominal x-ray, then that's when you would need to either get a pregnancy test to verify or call the doctor to see if there's an alternative. All right, great. So we have finished our aided. It is now time to position. Okay, I'm gonna put on my gloves now. Just remember that here at Harris Health, you are not supposed to wear gloves out in the hallways. So do not put gloves on, go out to get your patient and keep those gloves on in the hallway and then walk all the way back and still have your gloves on. Okay. Gloves should only be on once you are in the room. Okay. Now, as I was doing my aided, I'm looking at Thaddeus. And when I'm looking at Thaddeus, I'm thinking, as far as body habitus goes, what do I think Thaddeus falls under? Wide shoulders, stocky build.
Hyper?
Right.
Asthenic?
He looks kind of hypersthenic to me, right? His bone structure looks kind of like, big, broad-shouldered.
Mhm.
So I'm thinking, I set this up as lengthwise. I'm not quite sure I'm gonna be able to get his full chest if I leave this thin. So while I'm doing this, right, I'm thinking about this and I'm like, all right, I'm gonna go ahead and get this fixed up before I bring Thaddeus over. Okay. In addition, I do recommend that you get your equipment set up as much as possible before the patient comes in the room. Right, once the patient's in here, they don't want to wait 5 minutes while you mess around with the equipment. They want to come in, x-ray, come out. Okay, great, so I'm gonna come over here, stand chest facing the board. Okay, so now we're gonna do the PA chest x-ray. First things first, look for your centering. We are gonna center to T7. To find T7, we are gonna use our C7 positioning landmark, the vertebral prominence. Right, so in class we talked about checking the neck here, and then there's gonna be a bony structure that pops out right around here. We use our hand, we do like this kind of telephone thing. This should be about 7 inches, okay? Get a ruler or a tape measure or something at home, measure this out yourself. See how far you have to spread your fingers to get 7 inches. There's some people, really big hands, they don't need to spread so far. Other people, are like, to get their 7. So just figure out, for your hand, what that feels like. Okay, so I'm gonna do my 7 inches. It's gonna be right around here. So I'm gonna need to raise this up. Okay. Anytime you move the tube, you move the wall bucky, right? They are married. Where one goes, the other follows. So careful, I'm raising this up. All right, then you just step to your left just for a moment. Right? That way I can make sure that I've got this slide done. Great, come on back over. All right, good, as close as you can, Okay, so make sure the patient is all the way touching. Do not leave space between the board and the patient. Okay, so I'm at my T7 now. Next is centering left to right. This centering is going to be at the MSP, mid-sagittal plane. How do you find it? You look over here, you feel for the spine, or you feel for this dip. Right, so it kind of like dips in here, it dips in here. This should just go inside the dip. Okay, next, arm positioning. There are 2 ways to do arm positioning. Number 1, chicken wings. So back of the hands on the hips, right, chicken wings. And the idea here is that you take the elbows and you bring them forwards. When the elbows go forwards, the shoulders go forward, and when the shoulders go forward, they move the scapula out of the lungs. Right, so chicken wings, and then try and bring your shoulders forwards as much as you can. Very good. Okay, relax. The second way you can do this is having them reach around and grab these handlebars behind the machine. Good, there you go. Now, keep in mind, when they grab it, their shoulders do not go forwards normally. So after they hold on, you still need to come over here and ask them, okay, bring your shoulders forward. Okay? So you can do it either way, but the end result has to be shoulders go forward. Once that's done, we can finish up by looking at collimation and markers. So, right now, which side of Thaddeus am I standing on?
You're sitting on the right.
I'm on his right side? Okay, in that case, I'll go ahead and use my right marker since that is convenient for me right now. Right, so let me just take the marker, put it right here in the corner of the light. Okay, if for example, I was over here when I was like, okay, I need to put a marker, which side is this?
The left.
Left, so let's put a left marker here instead. Okay, doesn't really matter which marker you use for the PA, left or right, both are fine. Okay, lateral, yes, becomes very important. Here, just make sure the correct marker is on the correct side.
Okay.
Okay. I forgot. Okay, so this is a very important, good lesson for you guys. All right, I'm all set up for the x-ray, and then I realize I need to shield my patient. So that is a good step back for a bit. All right, I'm gonna put this around, see if we can Velcro this in the front. Does that reach?
Yeah, barely.
Barely, okay. Come back over. Now that he's moved, my positioning needs to start over. So, all right, let's see. Okay, I'm still at T7. Am I still MSP? Oh, okay, pretty good. His hands are around. All right, bring the hands down more towards the bottom. There you go. Okay, make sure those shoulders are forwards. Okay, I have my marker. Okay, great. Now I am ready. So the final thing to do, breathing instructions. Okay, earlier I said the breathing instructions are always going to be breathe in, breathe out, breathe in, hold, breathe. So, all right, Thaddeus, take a deep breath in. Blow it all the way out. Good, take another deep breath in and hold your breath. X-ray, breathe and relax. Now, Thaddeus did a great job. He stayed exactly how he was, he kept his chin up, he did the breathing instructions exactly as is. A lot of times, what you will find is if you're over here and you tell a patient, take a deep breath in, they turn their head towards you and they go, what? And then you have to start over again because they have messed up your position. So, to avoid that happening, while you are positioning, I recommend that you are talking to your patient and letting them know what's next so that they are prepared. So while I was doing my T7 and my shoulder stuff and doing my markers, right, I can be talking to my patient and saying, okay, Thaddeus, in just a moment, I'm gonna ask you to take some deep breaths for me. Okay, I want you to make sure that you stay looking forwards. Do not move while you take those breaths. I'll tell you to take a deep breath in, blow it out, take a second deep breath and hold it. Does that make sense?
Yes.
Okay, great. And so I'm doing that as I'm positioning, right? Doing it at the exact same times. And so now my patient is ready. They know what to do. Okay? Any questions about the PA chest? Okay, in that case, this time, that is, I'm gonna have you turn your whole body to face me, please. Okay, great. The next one we're going to do is the lateral chest. For the lateral, x-rays are coming from here, patient is here. We need to turn the shield, right? The shield is no longer between the x-ray tube and the patient. Good, turn it a little bit more. All right, great job, thank you. Very common mistake. Students go straight from PA to lateral, forget to turn the shield. So remember to do it, make it a habit. Okay, I'm gonna have you raise both hands up in the air like this. Very good. Okay, so the idea is that we get the arms out of the way, right? They can go straight up, they can do kind of like this to help themselves, right? Just don't dip the chin down, right? Make sure chin stays up, right? They can do this if they want. They can even, yes, grab on to this bar. So, keep in mind, this is not a chin-up bar. Patients should not grab this and try and pull themselves up on this bar. This bar is simply for stability, right? You just hold on to this and they rest their arms here. Now, important thing, do not let them do this. The reason is the arm is out here, it's pushing the patient away from the board. So, they should either be doing this or doing this, but the arm should not be going outwards. Does that make sense? Good. So this way, Thaddeus' shoulder is as close to the board as possible. I'm confident that I can't get him any closer. All right, right now he's standing nicely, right? The feet are slightly spread apart. Do not have the patient's feet together because they're gonna wobble. Okay, as far as height goes, height was pretty good earlier, right? We should have been at T7. Now, if you have a tall patient or sometimes on male patients, what you will find is that you want to actually drop your centering down by about an inch in between your PA and your lateral, just so that you don't miss those costophrenic angles at the bottom. In addition, for the lateral, it doesn't matter what kind of body habitus you're dealing with, switch this over to lengthwise. So I'm now gonna make this a 14 by 17 lengthwise. Okay, because when you're doing a lateral, all patients are gonna be longer than they are wide. Okay, as far as centering goes, we are going to be MCP, mid-coronal plane. The mid-coronal plane comes down this way, divides the body into equal left and right halves. Right, so it's going to be like right here underneath the armpit on most patients. Okay. So centering looks pretty good. I'm going to put my hand on his back to check for rotation. Remember, the patient needs to be in a true lateral. Now, always warn your patient before you touch them, so I'm going to be checking your shoulders and back, okay?
Okay.
All right, so I'm going to check here, and I'm going to check down here as well. The reason is because a patient can be lateral at the shoulders, but the hips can be twisted. Do you see that? At the same time, the hips can be lateral and the shoulders can be twisted. So you need to check top and bottom to make sure the whole back is lateral. Okay. Okay, good. Patient is standing nice and straight. Gonna have them lift their chin up slightly. Good. This time, which side is touching the IR?
His left.
His left. Good. So, move your arm just for a moment. Okay. Just have to make sure. So this time, I need to use my left marker. Okay. I've got some light here. So just squeeze my left marker into the light. And that is good. From here, I can do my breathing instructions. So chin up slightly, take a deep breath in, blow it all the way out. Take another deep breath in, hold it, X-ray, you can breathe, you can relax. Okay, one more thing, Thaddeus does a great job. It's easy to see him breathe, right? It's easy to tell when he's breathing. Right? Other patients, it might be a bit harder, so pay close attention, make sure they're actually breathing like you told them to. Something else to watch out for, don't do your breathing instructions too quickly. Right? Some students get too excited when they're ready to go, and so they're like, all right, deep breath in, blow it out. All right, deep breath in, hold, X-ray. Right? Not giving enough time for the patient to follow your instructions. So just watch out for that. Okay, great. You can bring your arms down. Thank you. All right, for our next one, we are going to do the AP now. Okay, so if you would swing your shoulder around to the front this time. Good. Centering for the AP is still going to be at T7. How did we find T7 earlier? Right, we looked for C7, did the telephone, went down the back. All right, so I'm gonna look for C7, and then I'm going to, there's an issue here, isn't there?
Mhm.
What's wrong?
It's his back that's towards it, so you need to see his front.
Correct.
And his interior.
His back's touching the board now, so I can't telephone down his back. I can't use his back for reference. I have to use his front. So in class, we mentioned that there were some positioning landmarks in the front as well. For example, there's the jugular notch. Right, so if I feel right over here, pardon me, okay, right here at the top of his sternum, there's the jugular notch. If I go 3 to 4 inches down, that should be at the level of T7. However, I'm only able to do this because I'm dealing with Thaddeus, who is a male. If I'm dealing with a female here, they're not going to let me do this kind of positioning, right? They won't let me measure here because this is a sensitive area. So we need a different method. So what we're going to do instead of using the jugular notch is we are actually going to use the axilla, the armpit.
Oh,
Okay, so here's the very corner of the axilla, the very corner of the armpit, and this should be at approximately the level of T7. Okay, remember, I have not changed my height since the PA. PA lateral, exact same height. And notice that here the axilla is also at this height. So this is the level of T7. Okay, just gonna switch this back over to crosswise. Okay, so find this corner of the armpit, put your centering there, that is gonna be about the level of T7. One more thing that you can use. While these shoulders are relaxed, if you check out here at the edge of the shoulder, there should be about 2 inches, 1.5 to 2 inches of light above the top of the shoulder. Okay, so, okay, I've got a little bit more than 2 inches of light above the shoulder here. So if I wanted to, I probably could come down a little bit more. Get a little bit more exact on this corner of the axilla. Pardon me, I'm gonna move this behind you. Okay. So here, right, 2 inches of light above the shoulder. For me, if I stack 3 fingers on top of each other, that is equal to 2 inches. That's 2 inches tall here. So that's why I'm able to measure out my 2 inches. So,
See, 2 inches
on the top of the shoulder. So here's the shoulder, 2
Oh.
inches.
oh, thank you.
Okay, so let's do everything for our AP, just like our PA. First thing was centering. Okay, we centered up and down. Now let's center left to right. Once again, we're going for the MSP. So step towards me, Thaddeus. Oops, sorry. Towards the board. Step towards your left. Yes, there you go. A little bit too far, come back towards the right. Okay, right, so straight down the center. Something else you can do, pat down his clothes. Look at where the light reaches on this side, look at where the light reaches on this side. Notice how the light is all the way to his left. Notice how I still have some shadow on his right, correct? So that tells me I'm not fully centered. I should see the same amount on both sides if I'm centered, right? It should be symmetrical. So slide just a little bit to your left. Good. Okay, now that looks a lot more symmetrical. Okay, bring your arms down. Let's see. Lean your shoulders towards the right just a tiny bit. There you go. Okay. So now it looks like we're straight all the way down, right? Down the middle of the neck, down the middle of the body. Okay, as far as the arms go, same thing as the PA. In this case, there's nothing for them to grab onto, so they have to do chicken wings. And then elbows still go forwards, right? Do not push it back towards the board. Elbows have to go forward. You're moving the shoulders forwards to get the scapula out of the way. Good. So bring those elbows forward as much as you can. Roll the shoulders forward. Very good. Okay. Try and bring your shoulders down as well. Don't raise them up too much. Next up is going to be markers and collimation. Collimation's already good, so I'm just going to use my marker. This time, which side is closest to me?
His right, sorry.
Is this his right side now?
Oh, no, it's his left.
It's his left, so be careful. Things flip between PA and AP. All right, put my left marker here, barely inside the light. And now we're ready for breathing instructions. So chin up slightly, take a deep breath in, blow it all the way out. Take another deep breath in and hold it. Good. X-ray, breathe out, breathe normally, relax your arms. Okay. And that is our AP chest X-ray. Any questions about this series, PA, lateral, and AP? These are kind of our basics. Okay, very good. Thank you, Thaddeus. Let me take this shield off. Great. And now let's get another volunteer.
Go ahead. Yeah, no, go ahead.
Okay, so
okay.
hold on to this, please. Okay.
Heavy.
Oh yeah, man, little lid, them man.
Okay, good. Back to the board, please. So this time we are going to do another AP projection. Flip it over to the side. Good. Okay, looking at one, we can afford to put this lengthwise.
I have the recording.
Once again, I'm going to start by doing my centering, right? So I'm going to look for the axilla, pardon me. All right, so armpit, lift your arm up. I'm going to start lift it out this way. Good, bring it back. All right. So just need to drop down a tiny bit. Okay, bring this down. Okay, I'm going to collimate. So I'm going to put the top of this light at the corner here where the neck and the shoulder meet. So this is basically how I would set up an AP. But this time we are not doing a regular AP. Slide over to the side, please. Move your feet as well, spread your feet apart. Like this. Good. So we are not doing a regular AP this time. We are doing the AP lordotic. So we're going to do the lordotic position. So yes, like we discussed in class, right? Lordotic, curving back like this. So, 2 ways to do this. Method number 1. Okay, I want you to step forward all the way to my feet. Both feet, very good. So, I'm gonna put about 1 foot, about 12 inches between him and the board. And then I'm gonna put my hand on his back and help guide him as he leans back to touch his shoulders to the board. So lean back until you touch the board. Good. Keep going, keep going. I've got you. It's okay, it's okay. I have you. Keep going. Good, right? It's like one of those trust exercises. Right? Okay, so that's one way you can do the lordotic position. Good. Stand back up. The other way, step all the way back again. Step back, step back. Good. Stay like that. Leave your back on the board. I want you to just shuffle your feet forwards. Good, keep going, keep going. Good. Tiny bit more. Perfect. And now, with your hips, I want you to just push the hips forward. Great. And you see, once again, we've got our lordotic position. But this time, right, with a lot less falling backwards. Okay, relax. So, those are the 2 ways you can get the patient into the lordotic position. Now, you notice that when he went lordotic, he kind of dropped down because he's leaning backwards. So, step backwards, sorry. Step back, feet backwards. Good. So, if I'm leaning backwards like this, right? And then I need to adjust the tube downwards. And then I need to adjust the bucky downwards. It's very scary to have the thing that's supporting your back suddenly slide down. So we want to move this as little as possible. The way we do that is we pre-position. So this is our AP. From our AP, what we're gonna do is we're gonna take the top of this light and put it here at the shoulder. So I'm gonna take the top of this light and bring it down until it is at the level of the shoulder. Okay, step to the side just for a moment. Okay. I'm also gonna drop my bucky down to match. Okay, come back over. So now you notice, right, top of the light is at the level of the shoulder. This time, if I have him shuffle his feet forwards, so, you can leave your back against the board. All right, okay, I'll help you. That's fine. All right, hips forward. Good. Now take a look at what happened to the light. It's over here. If you take a look at our laser, okay, axilla, mid-sternum, it's where it's supposed to be. So drop your stuff initially, so when they lean back, they lean into the correct centering. Does that make sense? Okay, great. From here, gonna do the same thing as before. Gotta do chicken wings. Good. Bring the elbows forward. Great job. Make sure you are MSP, straight down the middle. Okay, good. Okay, with your chest, try and puff out your chest as much as you can, right? You want to get a nice curve in the back for a lordotic position. Great job, hold it just like that. Okay, final things we need to do, marker. Okay, so actually I may have dropped this down a little bit too far. It looks a little bit low. Because I should have a little bit more light than this. Okay. So, okay. I'm gonna support us back. Okay, this is gonna move just a little bit. Try not to move, okay? Good job. Okay. Left marker for the left side. Okay. So, breathing instructions exactly the same. Chin slightly up. Good. Deep breath in. Blow it all the way out. Take another deep breath in. Hold your breath. X-ray. You can breathe. You can relax. Relax your arms. And then I'm going to help you stand back up. Okay. And that is your lordotic chest. Okay. So drop your equipment first. Lean them into the correct centering. Make your small adjustments as necessary, and then centering, marker, breathing instruction, and then help your patient back up at the end. Any questions about this one? All right, in that case, actually no, we'll leave it like this. Okay, so the next thing then that we're gonna discuss, let's discuss, actually no, you know what? Let's bring the shield all the way around to the other side. And you turn it so that it's on your back. Yeah, there you go. I'll help you hold this, and then you just do it in front. Perfect.
Okay.
Great. So turn around and face the board. The next thing we are going to do is oblique chest X-rays. Okay. Okay, so for oblique chest X-rays, we're gonna start by talking about the PA projection, the PA oblique. Okay, but remember, for position, it is either going to be the left or the right anterior oblique. It's a PA projection, but anterior position. Okay. Normally, on the order, it will tell you which oblique to do. In this case, since this is practice, I'm just gonna do the one that is easiest to demonstrate with. So we're gonna do the right anterior oblique, RAO. So start with your patient, PA, get your centering, right? So check, 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 aha, C7, measure down, T7, and this should be our centering, okay? Now that we have
In
our,
the middle.
so height-wise, here. I'm not too concerned about this because we're about to turn our patient. So, well, I'm gonna turn you halfway. Turn your feet as well, please. Good. Okay. So spread your feet apart like this. And point your toes towards me. Point, good. Point just up towards my toes. Perfect. Good. I'm gonna check your back. Very good. So, when you put your patient into an oblique for the chest, you want this to be a 45-degree oblique, halfway between your PA and your lateral. Very important that you get the feet 45 degrees as well, because if the feet are not 45 degrees, the hips are going to be twisted, and you're not going to have a good oblique. So the whole body needs to be straight and pointed in the same direction. Okay, from here, we need to do arm positioning. On the PA oblique, the one that is closest to the board will do chicken wings. So this arm will do chicken wings. And don't put the hand too far up, leave it lower, because you don't want the hand inside the chest. For the other hand, the one that's farther away from the board, you can put this either on top of the head, very good, or you can put it on top of the bucky. Either way is fine, but the idea is to get this arm out of the way. Okay, so one arm up, one arm down. Okay. From here, we now need to do our centering. On a PA, left to right, where do we center? Mid-sagittal. What about on our lateral?
Mid-coronal.
Mid-coronal. This is halfway between a PA and a lateral. So where do you think we center? Midway between.
Both of them? Okay.
The
The
sagittal
sagittal and the
and oblique.
coronal.
Good. So we're centering halfway between the sagittal and the coronal planes. So here's our MSP. Here's our MCP. Right, so here's our MSP. Here's our MCP. So if I just look for the center is going to be right about here. So I'm just going to slide him back until he's right there in the center. Good. Okay. When he is centered, you will also notice that the light on this side and the light on this side are approximately equal. So that's another way to check if you're truly centered or not. If, for example, you see something like this, I'm just going to move you for a moment. Lots of light here, shadow on here, right?
Mhm.
That tells you you're not centered. Right? Step forwards. Or lots of light back here, lots of shadow on here, that tells you you're not quite centered. Right? So it should be relatively even. It's not going to be perfect, but it should be relatively even.
Okay.
All right, good. Let's just make sure that our patient has not turned. And now, we've done our rotation, we've done our centering. All that's left is markers and collimation. On an oblique, if you can see both sides, right, we have both left and right sides here, you mark the side closest to the IR. So right now, which side is closest?
The right side.
Right side. So we're gonna put our right marker here. Okay, so I can see both sides of the body. I mark the side closest. From here, breathing instructions are the same as normal. Take a deep breath in, blow it all the way out. Good, lift your chin up slightly and take another deep breath in. Hold your breath. X-ray. You can breathe, you can relax. bring your arms down. Okay, and that is your PA oblique, that's your projection. This is also your RAO, right anterior oblique, that is your position. Okay, any questions about this one? So far so good?
Yes, sir.
Okay. We also have AP obliques. So turn around, turn the shield as well.
Is that shield heavy?
Huh?
Is that shield heavy?
Yeah.
Thompson.
Yeah.
You'll find out when you get to wear it.
Yeah.
Okay, back against the board, please. So, AP oblique, exactly just like our PA oblique in the order we do things. So first things first, he's AP, I'm gonna get my centering to T7. Okay, so check the axilla, make sure I'm at T7. Next, I'm gonna have him turn. In this case, I'll just have him turn towards me. That'll make things nice and easy for demonstration purposes. Okay, point your toes towards me. Perfect. Okay, great. Get a little bit closer. All right, get him in a nice 45-degree rotation. Once again, do not be afraid to go around and check the patient's back. I'm gonna check his shoulders and back, okay? So check, make sure you have good rotation. Now, this time we need to do the hands. For the PA, which hand did we say was down and doing chicken wings?
The side that was
one closer
touching.
to the board.
The one closest to the board. Good. So Dawn, if you would do chicken wings with this one. Yep, just, all right, good. And then take this one, bring it up. All right, is that comfortable? Does that look comfortable?
No.
Down.
All right, so that's incorrect.
Yeah.
So for this one, we swap them. The side closer goes up, the side farther does the
Okay.
chicken wing. So switch. More comfortable?
Yes.
Good. All right, so remember, between the PA and the AP, you switch your hand positioning. All right, from here, we're gonna do our centering. Exact same as before. MSP, MCP, we go right in between. All right, so here's our MSP, here's our MCP, right in between. Okay, so slide forwards.
So for centering, you move the patient.
So here we have to move the patient.
Okay.
So, great point. Do not move the tube for centering. Once you have locked into place, the tube and the bucky stay aligned.
Okay.
So you have to move the patient for your centering. Okay. All right. Fix your rotation. Here we go. Okay, right in between. Okay, slide forwards. Very good. There we go. So MSP, MCP, in between.
Shall we go from MC and CB?
Correct. So we find the middle. We do this. Okay. Very important though that you have the correct rotation before you try and find the middle. Because if you're rotating too much or too little, your middle is going to look weird. Okay, from here. Did you move? Just a little bit. Good. Okay, from here, we now need to do our markers in collimation. Which side is closest to the IR right now?
Left.
Left. So now we use our left marker. Okay, put the left marker inside the light somewhere. Okay, and then breathing instructions. So bring your chin up a bit. Chin up. There you go. Take a deep breath in. Blow it all the way out. Take another deep breath in. Hold your breath. X-ray. You can breathe, you can relax. Very good. And that is our AP oblique projection. That is our LPO, left posterior oblique position. Does that make sense?
Yes.
Okay. Any questions about these? Okay. One more important thing I would like to point out. Chest obliques, very, very rare. You're pretty much never going to see this in clinic. However, you will see oblique ribs in clinic. And ribs are positioned exactly like the chest we did just now. The only difference between chest and ribs as far as the setup goes is that instead of 72, you're at 40 for your ribs. Now, we talk about ribs, we learn about ribs in the spring. So if you can remember how to do this, right, through the fall, and you still remember in the spring, you will have a very easy time during the rib chapters because you've already done this before. However, I'm going to warn you, I say this every year. And every year when spring rolls around and I show the oblique ribs, students go, I don't remember this at all. First time I've seen anything like this. So, maybe this year will be different. Warning you now, right? Remember how to do your oblique chests, and it will help serve you for your oblique ribs. All right, great job. Thank you, Colin. Let me take this off you.
Thank you.
Let's see, what time is it? How much time do I have? I feel like I'm talking too much.
7:50.
No, yeah.
7:55.
Okay,
Good.
30 minutes. All right, so then that brings us to our final three, two of which technically are not chests.
Oh, the not chest?
Correct. We have soft tissue neck, upper airway as well.
Oh, I get to lay down.
I'm so excited.
I know. On the soft bed.
Yeah, soft table.
I know.
Another skill that you will learn is just how to quickly put a sheet onto these tables. Right? Looks easy, but then students take 5 minutes to do it, so something that you can try and practice on your own time. I forgot to get the less fancy cassette holder, so we're gonna have to use the super fancy one for today. Let's see. Right. Better grab my cassette and
She is real fancy.
okay, that should do. So the next thing we're gonna be doing is the chest decubitus. Left or right lateral chest decubitus. We talked about the decubitus in class. What are the key things that make a decubitus a decubitus?
have to be horizontal.
Okay, so yes, we are going to be horizontal with our beam. And what is the patient's position?
Whoever side
okay.
touching the table would be the cubitus.
Good, so they're recumbent, they're laying on their
Yeah.
side for a lateral decubitus. Okay, so free cassette, not inside a bucky. So make sure to switch this over to free cassette.
Okay.
Alright. And then we're gonna be aiming somewhere over here, correct?
Yeah.
All right, great. So, patient, if you would come on over.
Oh shoot, we might have to turn this a little
Turn
bit.
the
If you
camera.
want to turn it to make sure we get all of the views, then we can do that. I just don't know where to put it.
Let's see. But maybe like put it on something and use the sandbag to help prop it up.
Okay. How you want to prop it? I'm not the prop guy.
As long as it doesn't fall off and crack your foot.
If it does, it's fine.
Okay, great. So, come on over. Before you lay down, rule number 1 of the X-ray table, what was it?
Lock
Lock it.
Good. So, always lock your table before the patient gets on and off. All right, have a seat here, please. Scoot down just a tiny bit. Good. All right, lay on your back. Head over here by this pillow. All right, great. Once the patient is on the table, rule number 2.
Lock the table.
Rule number 2.
What, float the table? No, you gotta raise it up.
There we
You gotta
go.
raise it up, okay,
Raise
yeah.
it up.
You gotta raise it up.
Right. So, always raise up your table
Yeah.
to a level that is comfortable for you to work at. Okay, great. See, a lot easier for
Yeah.
me now. Okay. Now that we've gotten that done, we are going to try and get our patient into position. This is AP projection, and this is a lateral decubitus, which means the patient's side is touching the table. So in this case, for this to be AP, our patient's gonna need to turn this way. Great, so which lateral decube is this? Which side are they?
This is the right.
Right.
Yes,
Yes,
patient's on the
yeah.
right side. Good. Now, I'm gonna have you scoot back. Keep going until you touch the board here.
Oh, okay.
That's good.
There.
Great. Now, if you look from the top, it looks like the patient is touching the board, right? The shoulder is touching, this hip is touching.
Yes.
However, if you come here to the head of the patient and you look over here, you'll notice that
Space.
there's space right down
Oh,
here. This shoulder is touching, but this one is not. So is the patient truly AP?
No.
They're not. They are in an oblique right now. So
So I
you need to
need to
ask
sit
our
back.
patient to, yes, bring your right shoulder back. There you go. And now, this is truly an AP projection.
Yeah.
They're no longer oblique. Okay, great. Second, notice that our patient's already getting into position nicely by putting the arm here, resting the head on the arm. To help your patient out, take away the pillow. Smooth this out. Good, rest your head on the arm. Perfect. That's exactly what we want. Bend these legs, please. Bend both legs. Good. So legs stacked on top of each other. You bend the legs so that the patient doesn't wiggle back and forth, right? It gives them stability.
I have a question, like,
Yes.
like when I just did my x-rays like this,
Mhm.
you know, something I had to get a deal in between my legs because.
Exactly.
Oh, okay, that was okay.
So, since we do have a free pillow now, right? It's
Yeah.
not being used by the head. We'll stick this right
Okay.
here between the legs, give the patient some support.
Okay.
Right? The knees aren't bumping each other. Great. So this is how. So this is how we should start our chest lateral decubitus. Okay, patient on their side, all the way back against the board, arm up, pillow between the legs. Okay, this is a chest x-ray, correct?
Yeah.
So we said chest x-rays are always centered at the level of what? T7. This is an AP projection, correct?
Yeah.
How did we say we find T7 on an AP projection? That's right, the axilla. So make sure you start with this arm down.
Okay.
Right? If you start with the arm up, you can't find the axilla properly. So this arm starts down, and we're gonna kind of wiggle back and forth. So I'm gonna move this way, right, until we're at the level of the axilla. We're not worrying about locking or anything. I just want to get this
In the area.
to the axilla. Good. All right, now bring this arm up, please.
This arm?
Yes, please. Okay, so do you see my line right here,
Yes.
the shadow? So that's my central ray. So I need to line up my cassette to my central ray. So I'm just gonna slide this up until it's lined up, okay? Always center your
Equipment.
equipment. That's right. Okay, while I'm here, I'm going to check my SID. $78. Oh, I'll have to come a bit closer. $74. Okay, a little bit closer. 71. All right, a little bit farther.
Right.
Now, if you don't want to keep bouncing back and forth like this,
72.
just get somebody to hold it for you.
Okay.
Right? Someone can hold it for you, then you can just move this and look at the numbers as
Okay.
they change. All right. I just like to make things difficult for myself. So we have our SID. I do not want to change my SID anymore. I have my T7. I do not want to change this anymore. So really the only thing left now is centering this way, right? Patients left to right.
Yeah.
And how do we center left to right?
We're gonna do it
We're gonna be
mid-sagittal.
mid-sagittal.
That's right. We're gonna go to the mid-sagittal plane. Right. So close your eyes. I don't want to blind you with this laser. Okay. So mid-sagittal plane. Okay. It's gonna kind of like come down the middle of the neck, come down the middle of the jugular notch, right? Come down the middle of the body, exit here somewhere in between the legs, right? Mid-sagittal plane. The other way you can check to see if you're mid-sagittal plane, is there light above the patient?
Yes.
Is there light on the table?
Okay, so she's centered.
Okay, so if I adjust this collimation, right? So is there still light on the cassette?
Yes, it's a little.
Is there still light on the table?
Yes.
Is there light on the cassette?
No.
Is there light on the table?
No.
So they disappeared at the same time, right?
Yeah.
So that's how I know I'm centered.
Okay.
Does that make sense?
Yeah.
Okay. So, from here, bring this arm down just for a moment. Okay. I've got my 2 inches of light above the patient's shoulders. In fact, I could probably collimate in just a little bit. Thank you. You can bring your arm back up. And now, I need to use my markers. So, what kind of decubitus is this?
Right.
Right lateral decube. Which marker should I use?
Right.
No, the right.
That's it, right. But you have to,
Oh.
you have to probably use the left
Okay, so why do you think I need to use the left lateral?
because you can't mark the right.
Exactly. Yes, this is a right lateral decube, but how
Okay,
am I
mark it.
supposed to put
Yeah.
the right marker here? There's no room, the patient's in the way. So even though the name is right lateral decube, I end up using my left marker and I put it on the top here. Does that make sense?
Yes.
So yes, it's a right lateral decubitus, but I'm using my left marker. Right side is down, left side marker is towards the top. Okay. And then from here, make sure that we shield our patient. So, notice I didn't put the shield around the patient's waist from the beginning. That's because in this case, you just drape the shield over their waist like this. And then breathing instructions. So, take a deep breath in, blow it all the way out. Good. Lift your chin up slightly. Great. Take another deep breath in, hold your breath, X-ray, breathe and relax. Very good. Okay, and so that is our right lateral decubitus chest X-ray. Does that make sense?
Yes.
Okay, so for this one, I'll just say try and follow those steps in order, right?
Okay.
Once you get your patient all set up, find your T7 first, right? Then get your cassette lined up, fix your SID, right? Bring it back down, get yourself MSP, okay? Make sure you check the amount of light above the shoulders, put your marker and shield, and then you can do your breathing instructions at X-ray. Okay, great. So, let me take all of this off first. I'll take this pillow off. Thank you. Okay, try and scoot towards the center of the bed. Okay, notice that I'm gonna be over here on this side to make sure she doesn't roll off somehow.
Yes.
Okay, good, so just good. Get right in the center of the bed, but don't get off yet,
Okay.
right? Because patients love to jump off.
Yeah, you gotta.
And you're really high up, especially when you're working with me. So, hold still, don't move. I'm gonna drop this down. Okay, even after it gets all the way down, please don't move yet. Okay, so notice right as I'm dropping it down, I'm checking underneath, make sure there's nothing here. And then finally,
Lock it.
lock it before the patient gets off. And now you're free to get up. Thank you.
So I have a quick question.
Yes.
If we were doing, because that was the right lateral decubitus, if we
Mhm.
were doing the left lateral decubitus, would we move?
Yes.
Would we just, I don't
So you
understand it.
would move, you would take everything and flip it, so your head would be
Oh,
on this
okay.
side, feet this way, and the cassette would be somewhere up here.
So, okay. Okay.
So, right, so then I'll just have it set up like somewhere up here instead.
And then this would move over here.
Correct.
Okay.
Slide it down. Perfect. Great. So the final two projections we have to talk about are upper airway, soft tissue neck. So this is the type of X-ray you would do when a patient comes in and they say, I think I swallowed a fishbone. So you're gonna do a picture of their neck, of their throat, to see if there is anything there.
Yeah, we can bring it back right here. Because right here was really good.
So, sorry, I'm gonna need you to put this on. Good, I'll help you in the back. Alright, how'd that feel?
Feels good.
Not too heavy? Okay, stand over here by the board facing the tube. One more thing, when you do talk to patients, please don't say IR, tube, Bucky.
Okay.
Patients don't understand. So I'll say, okay, back against the board, face the camera.
Okay.
Right? Simple terms. So we're gonna start with the AP, yes, we'll start with AP upper airway. Okay. Once again, set up 72-inch SID. However, this time, upper airway, neck, smaller anatomy than the chest. So we are gonna use a 10 by 12 cassette for this. I'm gonna change my collimation here to 10 by 12 lengthwise. Okay, because neck is long. So 10 by 12 lengthwise. Now, as far as centering goes, we are going to check for the jugular notch. So I'm gonna check for your breastbone, I'm gonna check for your neck. Okay, right here. And from this jugular notch, I'm gonna go about 1 inch to 1.5 inches up. So for me, 1 inch is about 2 fingers stacked on top of each other. I'll put these 2 fingers right here on top of the jugular notch. And my goal is to put my centering right above this second finger. Okay, perfect. Do you see that? You can come closer. Okay, so right above that second finger.
Okay.
Since I moved my tube, I need to make sure to move my Bucky as well. So watch your head, I'm gonna lift this up. Okay. Tube, Bucky lined up, right? My equipment is lined up. Notice when I have proper collimation and proper centering, the top of the light here does not reach the opening of the ear. The top of the light is just slightly below the opening of the ear. Right? So that is what you are aiming for. You do not want light to cover the top of the ear. Okay. From here, we're gonna do some of our normal positioning. So we got our height. We now need to go left to right, which means we need to center MSB. So just slide, or in fact, because her feet are together right now, we can simply ask her to take her right foot and step towards the side. Good. You notice how that slides her over this way, gets her right in the middle, and since her feet are apart, she's less likely to wiggle around. Okay. Let's see. Okay, let's make sure your head is nice and straight as well. I'm just gonna kind of lean your head that way. Perfect. Okay. And same thing for your shoulders, just a little bit this way, right in the middle. Okay, good. So straight down to center. Now, there is one more thing we need to do. Because we're looking at the upper airway, we're looking at the neck, we want to make sure we get all of this. We do not want the chin in the way of our upper airway. So the question is, how much should we raise or lower the head so the chin won't get in the way? If you look at your notes, you will see that there is a brand new abbreviation, AML. It says to take the AML and put it perpendicular to your IR. What on earth is an AML?
Yeah.
So, this is something you're going to learn about more in the spring. But generally speaking, your AML, A stands for acanthion. Acanthion is this spot right here. You can turn this way.
Okay.
The acanthion is this spot right here underneath the nose.
Okay.
This is the acanthion. Okay. M is the meatus. You learned about meatus, right? Opening of the ear. So you're going to draw a line from the opening of the ear to this area right underneath the nose. And then you want to raise or lower the chin until this line is flat. Does that make sense?
Yeah.
So, meatus is here. There's the acanthion. So right now, you can see it's slightly slanted upwards. So bring your chin down slightly. Keep going, chin down, keep going, dip your head down, there you go. All right, so now, let's do a little bit more. Now you notice that it's pointing downwards, right?
Yes.
So, also not what we want. So raise it back up slightly, and there you go. Notice how this is now horizontal, right? It's pointing across. So, that is how much the chin should be up, right? Not too much, not too little, right? Just right, right? That's your Goldilocks zone. Okay. Very good. So, okay, looks nice. So from there, you notice there's a lot of light on the side of the neck. Collimate. You don't need all of that. Neck is thin. Make some thin collimation. Okay, which side is closest to me right now?
The left.
Left side. Which marker am I going to use?
The left.
The left marker. Great. So there's my left marker. And now it is time for some breathing instructions. This is not the chest, so we have some slightly different breathing instructions. For this one, we want to see the throat, the trachea, filled with air. That means this time we're actually going to take the x-ray while the patient is breathing in. So, to do this, I would first say prep your patient. Okay, Tori, I want you to take a slow, deep breath in. Slow, deep breath. Breathe in. Good. Breathe out. Okay, now let's do that again. Slow, deep breath. Breathe in. X-ray. Right, so
Oh.
I prep my patient, and now the second time as they breathe in, I x-ray halfway through their inspiration.
Oh, okay.
Does that make sense?
Yes.
Okay, and then at the end, breathe normally. Good job. So as they breathe in, fills with air, that's when you want to capture your x-ray. Okay, any questions about AP upper airway? Good. Also called soft tissue neck, because we're more interested in the trachea than the bones.
Okay.
Okay, turn towards me. We also have the lateral. For this lateral, hands are gonna go behind, shoulders are gonna come back, right? Because you don't want the shoulders in the way of the throat. So shoulders come back. Right. Patient is as close to the board as possible. Have them take their left foot, step over slightly. Once again, to give them some stability. This time, our centering is a little different. Rather than being about an inch above the jugular notch, we are going to aim right here at this corner where the neck and the shoulder meet. Right, so here's the neck, here's the shoulder, aim at this corner right there. That is going to be approximately C6, C7. Okay, careful, this is going to slide next to you. Great. I'm going to go around the back, check to make sure our patient is in a true lateral. Okay. When I feel here, I notice that the left shoulder is slightly in front, right shoulder is slightly behind. So I'll just grab both shoulders and turn the patient just enough to get them into that true lateral. Okay. As far as centering front to back, we are not going to try and center MCP. The reason we're not centering MCP this time is because if you look at the neck here, right? The throat is in the front, the spine and the bones are in the back. We don't care about the spine and the bones. We care about the trachea, the throat. So we are going to center towards the front of the neck. So you'll notice that when I center here, I'm centering here towards the front, right? I'm not centering here towards the middle or towards the back. I'm centering there towards the front. Does that make sense?
Yes.
Okay. Notice that because I'm centered up here at the height of this corner, my light now covers the meatus. So on the AP, the light did not reach the meatus, it was too low. On the lateral, the light does reach the meatus. Okay. For this one, there's no fancy AML or anything, right? Patient just looks forward and then slightly lifts their chin. And then as far as markers go, which side is touching the IR?
The left.
So which marker do I use?
The left.
The left, very good. Okay, put the marker here, make sure I don't go inside the neck. Do a little bit of collimation. Okay. Slide my patient forward just a tiny bit to make sure the throat's in there. Good. And then breathing instructions are exactly the same. So take a slow deep breath from me, slow deep breath. Very good. Breathe out. Same thing, slow deep breath. X-ray. As they breathe in, you X-ray. And then breathe normally, you can relax. That is your lateral soft tissue neck. All right. Any questions? Okay, in that case, we are done. That's it. Those are all your projections. Thank you, Tori. Okay, so let's talk about next week then. How much time do I have?
8 minutes.
8 more minutes.
Oh, okay. That went fast. So, for next week, we are going to be practicing. So you guys now get to do what I did for you. So everyone is going to practice PA and lateral chest because those are the two most common exams. They are mandatory on your test out. Everyone will do PA and lateral chest on your test out. Your third thing on the test out, randomly chosen. So you do need to practice the other ones as well. Time permitting, everyone will get a chance to try. If we don't have enough time, I'll let you kind of choose which ones you feel are going to be most difficult. Okay. We don't have a lot of time, right? 90 minutes, 3 people, you can do the math, right? 30 minutes each person. You've got 9 projections. So you only have about 3 minutes per projection if you're trying to practice every single one. Okay. So when you do come next week, make sure you come prepared. Right? If you come over here and then you turn to ask me, so where do I center for a PA chest again? Right?
It's the mid-sagittal, right?
It is mid-sagittal, very good. Right? But if you're asking me, that means you did not study enough, right? You want to be able to come in, you know
You just
mentally
need to
what you
do
want
it.
to do,
Okay.
and then you try it out physically to see what it actually feels like to position.
Okay.
Okay? So, that is our goal for next week. The week after that is test out. So for test out, each person gets 15 minutes. Each person needs to do 3 projections. 2 of them are PA and lateral chest. Third one, like I said, is randomly chosen.
Oh, so you choose it, or do we choose it?
So I have a little spinny wheel that
Oh,
was
okay.
from Wheel of Fortune.
I just wasn't sure if we had to like choose between the soft
Ah.
tissue or the decubitus.
So
Okay.
no, you just the rest of them are on the wheel. You randomly spin, and if you get lucky, it's an AP chest. If you get slightly less lucky, it's a soft tissue neck, and if you're even less lucky, then you get the decubitus. Or maybe you really like the decubitus, and then that's considered lucky. I don't know.
That's kind of easy too, though, because all you do is just switch your side depending if you right or left.
That's what I feel.
Yeah.
Some students disagree with me. But,
That was the one I was gonna
Yeah,
choose.
yeah,
Was the
Kelly,
decubitus.
how'd you do that one?
well, let's just see how it goes during practice. next
Okay.
week. Right? Okay. Any other questions for me about how this goes?
So our patient can't stand.
Mm-hmm.
Can we do the table bucky, like the internal bucky, as a laying down?
So it depends on what the doctor is looking for.
Okay.
Usually we try and get chests as upright as possible, unless there's no other way.
Okay.
And when I say no other way, pretty much the only situations where you would do the patient laying down is if they have a C collar on,
Okay.
that literally prohibits them from being upright.
Can we do chest X-rays at bedside?
You can do
You
chest
can?
x-rays at
Okay.
bedside, yes. So they'll be laying down in a stretcher,
You angle them.
lift up the head of the stretcher as much as possible, you slide that board behind your back, you aim in, and you can do a chest x-ray at the bedside that way.
Okay. Okay. I'm probably getting a little ahead, but I just wanted to make sure because we didn't really try it with the table bucky, so I wanted to make sure that we could.
Right, so at least this section, we're not messing with the table bucky. Next section, abdomen, that's when you're really gonna see table bucky come into play.
Okay.
Okay, any other questions? Are we feeling okay?
Okay, you can practice around with kids and my wife. And
Yeah.
Oh, yes.
Do it.
Thank you for bringing that up.
Yeah.
So, if you want to practice, yes, this room is available. You just need to schedule a time with me so I can come out here and make sure you don't blow up the equipment.
Oh, okay.
Okay. So yes, you are free to use this room to practice. Like, let's say Friday after school, you're like, it's 2:30. I've still got a bit of time. I want to come up here, play with it a little bit before I go home, right? Schedule a time with me and we can try that.
Okay.
However, you do not need this equipment to practice your positioning, right? For example, like you're talking about friends and family, right?
Yeah.
Grab your brother, grab your cousin, grab your best friend. Okay, find a flat wall, just shove them against the wall. Okay, maybe don't shove,
Yeah.
or shove gently.
Yeah.
And just be like, all right, okay, chicken wings, good. Up, shoulders forwards, chin up. All right, center right here. PA chest. Right turn. Nope, turn some more. All right, arms up. Nope. Better. Get closer to the wall. All right. Good, chin up. Good, lateral chest x-ray, right?
Oh, yeah.
You can position on basically any flat surface. And you can practice that way, right? Obliques, lordotic, right? Find a wall, right? Practice doing your lordotics. Not an issue, right? So yes, if friends, family, classmates, right? Use them to help you practice. And in fact, the more types of people you get to help you practice, the better, because now you get to see what it's like on different body types.
Yeah, I don't know.
Right? Because, for example, trying to do a chest x-ray on Thaddeus versus Antoine, it's going to be a different experience, right? Finding your T7 is going to be different locations for them, right? Doing your, right? Even just doing shoulders, right? It's going to be a different experience. And especially doing like a lordotic, right? Seeing how the body shape changes that. It's going to be a different experience. So get as much practice as you can on different people. All right, but yes, you are able to practice both in school and outside of school.
I'm definitely, yes. Yeah.
So The AP, the
Yes.
one that we just did on me for the airway,
Yes,
we aren't putting it to the MSP.
you are
You are. It's lateral that we're doing.
correct.
Like
when you collimate to the front.
So yes, if you're doing AP, you're gonna be
Mid-satchel.
here, slightly above the jugular
Jugular
notch.
notch.
So this is about T1, and your MSP.
Okay.
That's where your crosshair is.
Yeah.
But when you're sideways, you're not gonna be MCP here. You're gonna be slightly forward, centered on the neck here.
and that's the meatus. Or-
So the light, the top of the light is gonna be at the meatus,
Okay.
lateral. On your AP, because you're centered lower, the top of the light is actually gonna be under
Under.
the
Okay.
meatus.
Okay.
Good.
Okay.
Okay, well, 8:29. Go ahead and get you guys out of here.